mixed group here today. We have a lot of students, a lot of faculty. So I'm going to do a little bit of a mixed present as well, kind of giving you some background on how I developed my topic in addition to the results and the processes that went into it as well. So it's going to be kind of a hybrid research presentation, if you will. So take a second to kind of absorb this. This kind of definitely targets more of you in the grad student column, and many of you PhD level faculties will remember these days of your timeline of study and all the things that happened. So early on, we've got that, your advisor tells you all the wonderful things you're going to be doing, and it's going to be awesome, and you're going to enjoy all your time here. We've got lots of great things for you. And then you get into it, and you realize some of the personalities and the attitudes of the people that you're working with, and all of a sudden the picture starts to change a little bit. You're still really excited about working with your mentor, but maybe there's some stuff going on with your classmates. And then probably what I'm going to feel like here in about 30 minutes is I can't believe that I just summed up 6 years of my life in a 10-minute talk. So definitely an evolution of things as you're going through your studies. So a brief introduction, evidence-based practice. How many of you are familiar with what evidence-based practice is? Quite a few of you. So a brief overview of it. It basically is going to be a process of finding the best quality evidence to support the decisions that you're making. And this has been pretty broad in implementation as far as areas of medicine, nursing. Physical therapy came on a few years after nursing and medicine kind of went with the forefront of this. So overall, looking about 15 to 20 years of this process. Athletic training education, we're just starting to get into this process. It's really only become a push for us in the last 5 to 6 years, and we're finding a really hard time getting it into our clinicians and getting them to utilize it and really appreciate that there are more ways than what they've always done to find an ultimate good decision-making process for our interaction with our patients and our athletes. So we're kind of in this catch-up phase, if you will, athletic training-wise. So the process overall, there are generally 5 sequential steps that people take in order to arrive at their evidence-based decision. First is developing a clinical question. So really taking a look at the patient that you're interacting with, determining what are their needs, what is their condition, what are the important factors that weigh in to approaching how you're going to treat them. So you develop your clinical question from there. And that includes things like what a possible intervention is or a diagnostic technique, how we're going to rehabilitate somebody's spine in order to get them back to play, if there's any other things that might complicate things, such as maybe they have diabetes as well. So just kind of the whole picture of the athlete and what we're doing with them. From there, the second step is going to be searching for the best available evidence. So really getting into what is the current literature saying, also looking at what are the current presentations. So all of our symposiums and things, looking at what information is being disseminated there and combining that to see how it can weigh in and help our patient. Within that, we also need to critically appraise the evidence. So, we look at case studies, we look at clinical control trials, randomized clinical control trials. So taking those things, which one are we going to pay more weight to? Yes, the case study is very important. It might be very applicable to one specific athlete, but it's not going to be generalizable like our RCTs will be. And it's not going to give us as solid an answer. So not only do we have to find the evidence, but we need to figure out how important it's going to weigh into our decision. From there, that's when we really take a look at our clinical expertise. So really weighing in, what's your experience with this condition previously or this population of patient, and combining all those things to see what your previous experience and how it's going to feed in to helping this person in the long run. And lastly, we need to assess the outcomes, and this is multifaceted. Really looking at not only the outcome for the patient, but also how did the process go? Were there any glitches anywhere? Was there missing literature on one specific avenue? So really trying to go back and identify the strengths and weaknesses, both of your patient and the process. So some overall steps that you need as a student or a clinician in order to practice the EBP process. We need critical thinking, searching, appraising, and applying. So that's kind of universal. How many of you have ever bought a car? Quite a few of you. How did you go about buying that car? What were some things that were important to you, besides that it had wheels and could get you from A to B?
Price.
Price, absolutely. What else were we interested in?
What did it look like?
What did it look like? Is it appealing to the eye? What else?
Gas mileage.
Gas mileage for sure. How many of you talked to a friend before you bought your vehicle? Or a parent? Or got the input from someone else? So you're really doing that whole EBP process. It's just not called that in real life. So you're identifying what your clinical question is. What's your problem? I need a car. I I need a car that suits me. From there, you're going to go and you're going to find the evidence. What does it say about gas mileage? What does it say about safety ratings? What does it say? Is it a full-out trial that's comparing one car to another, or is it just that, it was Honda comparing all Hondas and they want you to know that Hondas are the best? So you really have to look at those types of things. Also, looking at other people's experience. How many people have driven a Toyota before? How many people have a BMW? How many people, what do they think about this? So you're really doing that process in life. Here we're just applying it specifically to healthcare, and I'm looking at it specifically from the athletic training perspective. And essentially we want cost-effective care. Athletic training is a little interesting because right now we are not available for third-party reimbursement, and we have the codes available, but the government will not let us utilize those codes like physical therapy, occupational therapy, things like that. So while nursing, medicine, PT, those guys are coming at it and saying we need evidence so we can bill for the best services. We don't have that right now, but we're striving towards it, and so we definitely need to get in early and establish our evidence so that we can get that whenever it becomes available. So overall, right now, some instructional components for evidence-based practice. This is starting to become more prevalent in athletic training, so this is more what's going on in nursing right now and medicine. A little bit of physical therapy. Again, they're a little bit behind as well, but not nearly as behind as we are. So things that others are doing, technology-based things. So webinars online, really having online training sessions, taking a look at tutorials, really trying to disseminate information to both professionals and students in that manner. Lots of folks are using journal clubs, so disseminating information, bring it back, appraising it, trying to figure out where that would fall within specific scenarios to help answer clinical questions or just general topics. A lot of short courses as well, so here's a weekend, 2 to 3 day course, really immersing you in it. Now those seem to be great at the initial levels of evidence-based practice, but once you get into more of the synthesis aspects, they're finding that these short courses don't do enough because it's not implemented over that longer period of time. Longitudinal curriculum, that is what we are striving for here at TCU, is having it really infiltrated throughout the entire process. So introducing the basics as their freshman year and then really building up to it to become that synthesis component. So kind of following Bloom's taxonomy, if you will, throughout their 4 years here on campus with us. Also, a lot of problem-based learning fits very well with evidence-based practice just by the questioning nature of it and kind of that collaborative process that you need in order to achieve it. Also, critical appraisal. We know that that's that third step of EBP. So if you have articles or specific topics that you can critically appraise, it naturally fits in to that process as well. So here's how I got interested in this. So this gentleman here, this is Sam Crowther. Sam Crowther is program director at Marietta College in Ohio, where I was working previous to my PhD studies. And I went on my interview for my doctoral position, and they said evidence-based practice is the next thing in athletic training, and I said, what is that? And so I figured out that I needed to learn about it pretty quick. And I went back and I asked everyone that I worked with, and I said, do you know about this? And they said, no, we've never heard of it. And I said, well, it's coming, and we better figure it out. And he said, Sarah, I'm opening a bakery. I don't have time to get started on this, so we're going to be a little behind here at Marietta for a while. And I said, how many other people in the country are going to be in the same exact boat? Somebody needs to solve that problem. Enter me. So I set out to solve the problem of trying to get the information to the people that weren't going to go out and seek it for themselves. So I decided that I needed to take a look at evidence-based practice instruction, what was already going on athletic training-wise, comparing it to what was going on in the other professions, and then develop a model to disseminate that information out. So what you're going to see today is first I'm going to review kind of the strategies that people are using, and then we're going to go through to the barriers. So just to give you kind of a framework of what we were working with within our doctoral program, it was really kind of try to have publications in existence before you graduate. So ultimately out of this whole process, I ended up with 4 manuscripts, 3 of which have already been published. One is already approved, we're just waiting for it. It should be in December of this year. So really trying to promote getting this information out as fast as possible and not waiting past your graduation date and all those sorts of things. So we'll start there with our strategies of what's currently going on evidence-based teaching-wise in athletic training. So the purpose of this first study was to evaluate the existence of athletic training educators' experience in instructing evidence-based practice. Now with this we went out very purposeful. We only went to the people that we knew were doing it because we wanted that information. If we'd have gone to most of the people in the country, they said either we don't know what it is or we don't know enough about it yet to teach it. So we went to the very targeted people that we knew were doing it. From there, we tried to establish from them what their institutional approaches were, what their instructional approaches were, so that again, we could disseminate that out to the body of our profession and get things started. So methodology, 11 educators, 3 males, 8 females. You can see their teaching experience there. The snowball chain, that is where we find the name of someone that we know is teaching it, and during the interview process, we ask them, do you know anyone else that is doing this? From there, we contact that person. And they basically had to answer yes or no. Yes, I'm teaching this. No, I'm not. If they were a yes, we interview them. If they're a no, they're off the list. So it's kind of like that snowball getting bigger and bigger. That's how that forms. We only looked at Katie accredited programs. At this time, there were approximately 356. So of that 356, only, as far as we knew, about 26 were actually teaching evidence-based practice at the time. So we actually almost had half of those that were known to be teaching it.